welcome everybody. This is Dr. Clayton Chow and Dr. CK. Welcome to another episode of Your Health Matters OC. Tonight we are joined by Jennifer Forrester. I said that right.
Yes.
Our supervising environmental health specialist. In my mind, she is the expert from the healthcare agency in anything related to lead poisoning. So that is our conversation for tonight. So I look forward to that. Thank you so much, Jennifer, for joining us. But as usual, if you have any question for us throughout the day or throughout the show, send us an email to yourhealthmatters@ochca.com. Again, that email address is yourhealthmatters@ochca.com. So, as usual, Dr. CK, you want to give us an update on COVID and monkeypox?
Oh, yes. So COVID numbers still remain pretty stable. Our case rates are now at 7 per 100,000, which has decreased from last time. And our positivity rate is 6.6. Now, caveat, as I said in previous episodes, is that this relies on people testing with PCR results. This does not reflect the number of cases that are in the county detected by home test. And we know that many people are doing a lot of home tests, and in some cases people have symptoms and are not even testing at all. So this is likely an underestimate of what's actually going on. Our hospitalizations also are pretty steady, with about 125 requiring hospitalization with COVID and 21 cases requiring ICU care. And again, the majority of people who get hospitalized are still ones who are not vaccinated or who are incompletely vaccinated. In terms of our vaccination rates, we have a slight increase compared to the last time we spoke in how many people have been vaccinated. We now have over 2,355,864 who are fully vaccinated. And I know we have stats on vaccines in general. Our kids still remain the population that has the least amount of vaccination, with only 7.9% of those aged 6 months to 4 years receiving at least one dose of a COVID vaccine, and only 3.9% who are fully vaccinated. So we still have a long way to go. And as you're hearing in the news, there's many different Omicron subvariants that are circulating, and our best chance to fight this and protect ourselves is actually the newest vaccine, the bivalent vaccine, which we now have availability from Moderna as well as Pfizer locally. And really anyone age 5 and up who has completed their primary series or has received a booster, as long as it's been 2 months since either that last booster, monovalent booster, or that completing the primary series, is now eligible to get a bivalent updated vaccine or updated bivalent booster shot. So please, if you're 5 and up and are eligible, please get your bivalent vaccine. I know I'm encouraging my friends and family to do so. I've received my bivalent vaccine. It's your best way to protect yourself, aside from wearing masks and continuing preventive measures from the circulating subvariants.
Where are we at with the monkeypox, CK?
Monkeypox cases have been declining.
That's great.
We also increased our eligibility for the vaccine, the monkeypox vaccine, so you can go to our website for more information on that. But right now we have a total case of load of 271 since monkeypox was here in Orange County. So that's actually been pretty stable since the last time we spoke, and only 15 that required hospitalization. So that's only a change of 1 or 2 cases from the last time we spoke.
But that's good, I think, because we use the COVID-19 approach to it, right? And tactic, I guess that's the word I was trying to look for. And so we really provide concentrated education to the high-risk group.
Correct.
And get people into testing and vaccination. So I think that was the successful in terms of the way we respond to monkeypox here in Orange County. So kudos to our team, the public health team. Seasonal flu vaccine, talk a bit about that.
Yes.
I know we've seen cases. I actually have a very close friend who was just hospitalized from the seasonal flu vaccine. She didn't get her vaccine. She didn't schedule on time to get it, and she got it from somebody, and she was actually hospitalized. So pretty severe.
So this year is a unique year in that over the last 2 years, we've actually been protected from flu because a lot of people have been using preventive measures. We've been distancing, we've been wearing masks, and so we had our lowest numbers of flu cases in the county. But as we know this year, there's been a lot of relaxing of using masks and preventive measures. And unfortunately, we started to see a lot of flu cases in the summer that have already popped up. And we know our neighboring counties have experienced a significant rise in flu cases. So, even if we may have low COVID cases in our community, according to the CDC, it is still strongly recommended that you use everything you can to protect yourselves, especially against this flu. We know the Southern Hemisphere had were significantly impacted, especially Australia, and flu there impacted the children. So I'm expecting, unfortunately, for us to have a severe flu season, and it's already starting. So if you haven't gotten your flu vaccine yet, please go get one. And just specifically for 65 and older, we know they're also at risk, especially for hospitalizations. There are specific vaccines for flu for that population that are higher dose and different formulation that will improve immunity against the circulating flu strains. So please contact your provider or your pharmacy to ask for that special flu vaccine.
So in Orange County, if you are a healthcare provider or if you are a first responder, there is a mandate for you to get the seasonal flu vaccine. And for the general public, there's a strong recommendation.
Correct.
But clearly, if you have chronic health condition, if you're elderly, please get the seasonal flu vaccine. I know the last 2 years we've been expecting a twindemic, and thank God it didn't happen, but this year definitely is going to happen, right?
And twindemic, you mean that we're going to have a rise in hospitalization in cases of both flu as well as COVID, and
That's correct. That's correct.
Yeah.
So generally, if you have cold symptom or flu symptom, please stay home. I don't know how important I have to stress that message is that if you are sick, if you don't feel well, do not show up to work. You need to call your employer. You need to contact your primary care physician to make sure that you're taken care of. Please don't show up to work and spread it. And we hear a story of people still show up to work and spread either the flu or COVID to people. So please stay home.
Right.
That's good?
Yes.
Okay. So Jennifer Forrester, welcome to the show tonight. So excited to talk to you. One of the things that we don't expect to happen here in Orange County, but clearly we do have severe cases, 1 or 2 cases a year, right? We don't want to alarm the public because we do have severe cases, although really small in number, right? But we do have some statistic that the screening process for lead poisoning, we are doing just okay, not optimal, right? First of all, let's define what is lead, and then where do you find it, and what is the laboratory value currently that defines somebody might get lead poisoning. Although any lead level is not acceptable, but there is a standard that we screen in children, right? So
Right.
Go ahead.
Right. So lead is an environmental ore. I mean, it is a heavy metal. So it exists as galena in its whole state, but it is very malleable. It can be broken down. So therefore, it's used in a lot of different applications, right? So we know it's in batteries. It also is a great conductor. So it was used in early radio. We will actually show a clip that talks about the history of lead. It was used in gasoline before it was eliminated, but it's oftentimes found in paint,
Okay.
lead-based paint. And so although that has been removed as of 78, we still do find it in older homes. It still creates lead dust, and there's still concerns to ensure that families are kept safe, even ones that are living in older homes, even ones that are in higher risk occupations. So how do we identify that, right? Testing. And although not everyone has all of the resources to test a home, it can be a couple $100s to do a risk assessment. They need to know, if they live in a pre-78 home, that there are federal regulations for notifying a renter when there is lead-based paint in a home. And so there's a handout or booklet that should be given. Now, maybe you might ask the question, okay, I wasn't given that. How am I supposed to know?
Right.
So you can always call us.
Right.
We can always discuss. We can talk about a game plan. We have public health nurses who are great advocates for the family and the pediatrician, and we also have environmental health specialists on the team as well.
So that's interesting you say that, because I bought my home and it was built prior to 1965. I think 62. I don't remember exactly. Definitely before 1978, right? I don't remember that the realtor or the owner ever giving me information about the paint or the pipe, or maybe I was informed about the pipe, but I didn't understand all of that. I don't remember I'm a physician, for crying out loud, and I went through training, but because I'm not a pediatrician, I just don't remember that kind of detail. And I don't remember my realtor ever told me, or the homeowner, and that was the original homeowner, ever said anything about lead. So how do consumers know about this kind of information?
Right. So similar to your situation, if a person or a family is purchasing a property, it does have to be disclosed in the real estate disclosure.
Really?
They actually get up to 10 days to have the home tested. Now, for lead-based paint through a risk assessment. Now, should you not know to take that action, in those cases, you can assume that there might be lead in the home, because we know that homes built before 1950, about 40 range and below, that could include historic homes, have a much higher chance. So they say upward of, let's say, 75% chance that might have a component with lead. So, and as you move forward, that decreases. So in your case, you said 1960, yep. Right? You might be, a 1 in 4 chance that a component would have lead.
So who's responsible to do that? Is it the homeowner responsible to test it, or is it the buyer responsible for
the buyer? So if the buyer would like to have that done, they have 10 days to complete that. And again, it's a couple $100, anywhere from the $200 to $300 range to access the whole home. And then, you mentioned plumbing too.
Yeah.
So plumbing, we know that 1960s galvanized pipes were used. And so there are risks attributed to either through lead service lines or in the private residence through fixtures, solder, different materials that are used in plumbing that can leach into lead. And so that needs to be, brought to light.
So this was very interesting, because you and I was both in a training last week about this, given by the State Department of Public Health, and she said something that I wasn't aware, right? Oh, I'm exposing myself and how little I know, right? Is that the public pipe system might be new and changed, but the connection between the public line to the home could be old pipes, right, have not changed, or coated over, and that we have to be really careful in knowing our pipe system and really get somebody to come in and evaluate. And it's specific people, right, that you ask to bring in to test your home. So talk about that, and how do people find information?
So the first part is just in doing a lead inspection risk assessment. Okay. And so those are certified individuals with the state of California.
Okay.
Our team of 5 at the healthcare agency, we hold that certificate, and we can investigate lead cases and conduct that as part of our services for lead cases in our grant. However, we do address families with concerns too, and let's say that child has a lower level, they don't meet. We can decide to go out to the home as a preventative measure. We don't want to see that level climb. Okay. And so that's an intervention that we can do. We can also coach families on where they need to go to find this resource, which is on the state website under the lead program. Okay. And so there are individuals actually listed by name with under their specific work title for lead in construction.
On the state website.
And their phone numbers.
Okay.
And so those are a resource to assess if the home has lead. And then for plumbing, it's a simple water test.
Okay.
And so to my knowledge, it's about $25 to $30.
Okay.
And I've seen some information on the State Water Resources Board website. Good news for folks that have child care facilities and in-home child care services that are registered with the state. There's grants available right now that folks can reach out to their cities and they can have that free water test, because that is a mandate for 2023 coming up for child care facilities.
Great. This is so good information. I have more questions for you, but let us go to our first video. This video will give us a brief overview of the history of lead and its presence in our environment. So let's take a look.
Because of its low melting point, the Romans found lead easy to cast into all kinds of products, which helped make Rome the capital of the ancient world. In fact, the Latin word for lead, plum, is where we get our word plumbing. Lead was also used as a complementary flavoring in Roman wine and food. Yet Romans were aware that lead could pose health problems. The Roman architect Vitruvius cautioned against using it in pipes to conduct drinking water after observing the illnesses plaguing lead foundry workers and miners. And the disease Saturnine gout was prevalent among the Roman aristocrats who imbibed heavily in the lead-laced wine and food. Some historians even blame the fall of the Roman Empire on lead poisoning. Today, we know just ingesting small amounts of lead dust can lead to brain damage and even death. How potent is lead? A child can be poisoned by only 10 milligrams of pure lead. To give you an idea of what a small amount that is, this spoonful contains about 4,000 milligrams. However, those same properties that attracted the Romans made lead popular to many different civilizations throughout history. It's almost impossible to find a portrait of an ancient Egyptian who didn't decorate their eyes with eyeliners made out of ground-up lead ore. And in medieval times, lead was the first choice metal for the movable type of the first printing press in 1455, and was used in lead light and stained glass window frames. Lead ore, also known as galena, has been collected throughout the ages. Galena always breaks in cubes with smooth surfaces because of its unique crystal structure, a property that ushered in a new wireless technology at the turn of the 20th century. It was learned that galena crystals could detect radio signals, and it wasn't long before the favorite wireless device of the time was the galena crystal radio set. Also developed in the 1920s was one of the most significant and damning uses of lead as a fuel additive. It was found that when the extremely poisonous compound, tetraethyl lead, was mixed with cheaply refined gasoline, it stopped premature combustion of the fuel-air mixture in a car's engine. This is known as knocking or pinging. Despite health concerns from the beginning, it took 70 years before leaded gas was completely phased out for use in on-road vehicles.
Hello, welcome back to Your Health Matters OC. This is Dr. Clayton Chow, Dr. CK, with our special guest tonight, Jennifer Forrester, our amazing environmental health specialist who knows a lot about lead. That's why she's here tonight, talk about lead poisoning. But before we continue with our conversation, if you have any question for us, any one of us, please send us an email at yourhealthmatters@ochca.com. Okay, so that was a very helpful video. I think it's give people a general idea of the history of lead and what have you. What is the statistic here in Orange County, and what are the base values that the CDC has set recently?
Right, so with CDC last October, they actually lowered the lead reference value. So what does that mean to a person? What is a lead reference value, right? So when we look at a measure of blood, it is actually microgram per deciliter in the blood. And so on average, lead will stay in the blood for 30 days. And so that number can be measured through either a simple blood prick screening or through a venous puncture, which is drawing blood. And so CDC evaluates this every periodic. And so the last time that it was lowered was 2012. So 2021, last October, it went from 5 microgram per deciliter down to 3.5. So the message, the drive-home message is there is no safe level, right? The intervention level is 3.5. And then for a state case, we start with a 9.5. We can round up to 10, or you can have 2 within a 30-day period at 14.5. And so really what this means is that we need to do a better job of capturing those lower levels and preventing. That's the drive-home message.
Okay.
And we need to get more kids tested.
So what is the statistic in Orange County?
So for Orange County, if we want to look at the rate of percent of kids that do get tested and are at 4.5 microgram per deciliter, so the percentage is about 1.03%. Okay, how does that match up with maybe the state? And so for Orange County, we're at 28 out of the number of jurisdictions. 58
county.
Okay. So what we want to say is we're doing good, but we could do better.
Yeah. Actually, it's 58 county jurisdiction, but 3 city jurisdiction, right? Because there are 3 cities that have their own public health department.
Correct.
So
Correct.
yeah. So we rank 28.
28. This is from the statistics, I believe, from 2020.
Okay, 28 meaning the smaller number is good, right? The bigger number is bad. So
Right.
we rank number 28 out of 61 jurisdictions.
Correct.
Basically. Okay.
Correct. So
And the CDC lowered the number, meaning we really need to catch kid early, right? So I know the American pediatric recommendation, or the state recommendation, actually, the state recommendation is test kid at 12 months and 24 months.
You
And
can
then,
test sooner if you screen a family to be at high risk.
right, but the recommending screening for everybody, every kid, is 12 months and 24, right? And then there's some catching up if you miss the 12 months or you miss the 24 months.
So
testing.
typically at the well child visits, we're going to ask every family, usually especially at the 6-month age into 9 months, every time a child comes in, we just keep asking. And so parents, when you're looking at those questions, does your child, it's not that we're asking if your child's going to like take the wall and eat it, but if you're in an older home, if the child puts a lot of toys that may, that may be from out of the country, right? We start running in the risk of lead exposure. And so usually we'll be offered, even if you screened out negative for those questions, like you don't live in an older home, your kid's not licking the paint off of the wall, is not putting a lot of toys in their mouth, you can still opt to get screened for lead. Because as we just talked about, there's so many different ways to get exposed. Now, the concern I have as a family physician is that many times when this is offered, parents think about it, but when we talk about how the blood is drawn, that's where the line is crossed and the barrier is placed, right? Because a lot of parents don't want their children to get stuck, to get blood drawn. So that's definitely a barrier. But I would say if you think that your family is at risk or your child is at risk, it's a really good idea to get screened because we know lead can really affect the child developmentally.
But I think the important piece is, even if you are a young parent with young infant and you live in a brand new home just built recently, it doesn't mean that your kid is not exposed to it, because there's other things in our environment that could expose your young kid to lead. Am I right?
Correct. So we talked about take-home dust
Yep.
through certain risk occupations,
Yep.
but there's also in food,
Okay.
right? Or pottery, if
Okay.
folks use more traditional pottery to cook with, or put food into, or even beverage that can leach into food and water. And we also know that there's a huge push with FDA right now. I know with lowering that daily intake level and eliminating those sources such as spices that are imported. And so it's definitely a concern for sure. And I think you have to look at, are you engaging in riskier behaviors?
But so here we just talked about this before the show, right? So certain supermarket, was that within the last year, got recalled for ginger candy.
Correct.
Because of the level of lead in there, right? So we talk about people who buying canned food or even candies or even potteries that was done outside of the U.S., right? If we were doing it right, meaning testing every product come into the U.S. for lead, then why do we have this situation of recall?
So to answer the first question, so lead in candy, there's actually a program at CDPH,
Okay.
the state,
Okay.
and their Food and Drug branch does testing for items that are candies, though, coming
Okay.
across the border.
Okay.
And so they will issue recalls for those candies and work with the manufacturers to reformulate their product and look at the packaging and make sure that there's a safe product coming in.
Right.
And so that is a lower level of lead, but we still need to make sure it's within the parameters. In terms of for other like canned foods, it's not often that there are recalls, although there was one more recently within the last year. And so oftentimes foods that are produced in the U.S., you're not necessarily going to see that in canning anymore, although it was a higher risk back in the 50s and before they remodified what cans are made of.
So we're not talking about every single foreign product in the supermarket that you found that you have to worry about. We're talking about people who travel abroad buying candy, buying, souvenir stuff that could be painted by paint that contain lead. Right?
Correct. So folks that might have family abroad and they'll ship product
Yeah.
back. That is oftentimes our non-housing, as we call them, non-housing sources that we'll find in lead cases.
Right.
Spices like turmeric or other sorts of home or cultural remedies that folks are engaging in or bringing in. Surma, such as eye makeup, which we saw in the video earlier.
And I'm looking straight into the camera because I know my friends watching, and many of them ask family member to send them candies or travel abroad and bring in candy. You, my friend who's watching, I'm talking about you, that really didn't come through the proper channel. The state testing it, what have you. And they might inadvertently eating stuff or using stuff that are, laid not intentionally because of the regulation outside of the U.S. might be very different, right? Because even there's effort worldwide to do this, but there are some country that still have folks who make products that continue to have lead, right? And maybe the knowledge of the products producer, whatever you call it, are not really great, and they're not paying attention to it. So it's not intentionally poisoning the product, but unintentionally because of the knowledge, right? I mean, if we still struggle in the U.S. to get family and kid to be tested, imagine outside of the U.S. People might not be aware. Forgive me, I don't mean to say anything, but there are. I mean, there are some countries with less infrastructure for the system to measure everything, right?
Correct.
And so then you inadvertently bring it in and you poison themselves, because we've heard cases like that before, right?
Right.
People who bring in candies and food product from that are not bought here in our own supermarket, spices and stuff like that. Because that's a tendency. You travel, you see stuff that don't exist here in the U.S. You're curious, and you buy it and you bring it home.
Or a good price.
Good price, yeah.
Or
great product. Like I have a tendency to buy, smaller pottery stuff or toys for my nieces and nephew that stuff that you don't find in what is a toy store, Toy R Us or Target store. I mean, they look kind of cute and nice and good price, and you just buy them unintentionally, right?
Right.
And you poison your kids. So, what do? Wash toys.
That's a basic, right?
Okay,
Washing
very
toys
good.
so you can remove any lead dust.
Okay.
We also have Consumer Product Safety Commission, which does test toys, and so they make sure it's below a certain threshold when it does come or is imported into the country. So things like children's jewelry or kids' toys, those are ones that are pretty regulated, and so they do have a recall page if you...
I'm very interested in that. Let's get to that, right? Because I think we need to give our family tips around that, right?
Yes.
But before we go there, let's take a second break to our second video, which talk about how lead can enter your home and how you can prevent it. Maybe that be the answer, and we don't need to talk more. We will talk more. Let's take a look.
The Centers for Disease Control and Prevention says children living in 4 million U.S. households are being exposed to high levels of lead. Lead-based paint and lead-contaminated dust are the most common sources for lead poisoning. It is very important that adults who are exposed to it in their workplace take important safety precautions to protect themselves and their family. Lead can be found in all parts of our environment, including the air, soil, and water. Lead has been used in a large variety of products, including paint, ceramics, batteries, and plumbing materials. Adults who work in places where lead is present can often bring lead dust home on their clothing, skin, or shoes. Workplaces where lead is most likely present are home repair, renovation, and painting, automotive painting and repair, radiator repair, handling and manufacture of guns and ammunition, welding, offshore oil work, road work, repair and painting of bridges and roads, recycling of metal, electronics, and batteries, the manufacture of glass, plastic, and rubber, plumbing, and ship and aircraft building and repair. Participating in certain hobbies can sometimes lead to lead exposure. Hobbies that contain any type of lead contaminants should be done outside of the home.
Such hobbies include glazing and making ceramics, leaded artwork, making and handling ammunition, and fishing weights.
Target practice, remolding old jewelry, stained glass, and refinishing antique furniture.
So, who is at risk? Children under the age of 6 are more likely to be affected by low or high levels of lead. Children are more vulnerable to lead poisoning because they absorb 4 to 5 times more than adults from a given source. Pregnant women are at risk for pregnancy complications and exposing their unborn child to lead poisoning. If you have had a current or past exposure to lead, the unborn child may be born with an elevated blood level. Lead exposure causes cognitive, growth, developmental, and behavioral effects in children. Severe lead poisoning can cause anemia, renal disease, and central nervous system effects. So, how do we reduce the risk of lead exposure to our loved ones?
Under federal regulations, employers have a responsibility to ensure that workers are protected from harmful lead exposure. Employers must provide personal protective equipment for all employees. Regular inspections of job sites, materials, and equipment must be completed to ensure employee safety. Employers must also provide a detailed description of each activity in which lead is emitted.
Work clothes and shoes can be contaminated with lead dust. Change into clean clothes and shoes before entering your home to reduce the risk of bringing lead into your house. Shower before coming into contact with other people and any surfaces touched by children. Avoid stirring up lead-containing dust from dry sweeping or blowing. Use wet cleaning and vacuum with the HEPA filter instead. Be sure to wash your hands and face before you eat, drink, or smoke.
There is no level of exposure to lead that is known to be without harmful effects for children. If you think your child has been exposed to lead, please contact your primary care provider or local health department for testing.
Hello, welcome to Your Health Matters OC. Today's episode, we're talking about lead poisoning, and I think it's getting very interesting. I'm learning a lot, so thank you so much, Jennifer. Beginning of the show, I said, are you the subject matter expert on lead in Orange County? And you were so humble and said, oh, I don't think I am. But lead poisoning is not about only the medical aspect of it, right? It is an environmental aspect of it, that there are information that you share. I don't believe as physicians we were trained to the extent of what your knowledge has given you and in your years of working for the county and paying attention to this piece, right? Because it has to do with, I hope people pick up that it really has to do with an advocacy perspective as well. Because if you're poor and you don't have money and you don't have the knowledge, honestly, to be aware of this, you wouldn't ask. I mean, I didn't ask my realtor or the seller on testing the home that I bought from him, and it was built before 1962, and I had some basic knowledge about lead, but it completely, skipped my mind, and I didn't even think to ask. And I don't know whether or not, because I don't have children, and therefore I subconsciously didn't have any concern about it, but it really also does affect adults, right? Not just only children.
Absolutely.
So let's talk about that. What is the medical complications of lead poisoning? Either one of you.
Oh, so it can cause a lot of different things.
Okay.
Headaches, seizures, developmental issues in children is what you're going to notice, maybe even some fatigue. If we were to get into blood work, then we might actually see some anemia. Maybe it will affect your kidneys, your liver. So there's a lot of different effects. If it's really severe, it can affect your oral cavities, and your gums can have a really dark color to it, and also can retract. So there's so many effects, but really we're more concerned about the neurologic effects of lead. And for certain, like as you saw with CDC, they were saying that there's certain occupations that put you at higher risk. And so certain occupations will have an occupational provider who will be monitoring that. So I think back in my military career, we were monitoring people with lead, and we did see some cases where people had, the lead level where you start being concerned, but we really just monitored to make sure their liver, kidney was not affected and that they don't have any symptoms. And usually these people don't have symptoms. But the next step then is, well, what do you do beyond that? And it's going back to basics, making sure that they have cleaner, they reduce their risk to their family members, taking off their shoes before they enter the house, reducing the dust in the home, and then eating a healthy diet. It goes back to eating healthy, lots of fruits and vegetables, vitamin C-rich foods, and hydrating.
So the Asian approach to when you enter my home, take off your shoes and leave it outside the door, actually have some medical environmental prevention rather than just a cultural issue, right? I'm teasing you. Yeah. but by the time a kid or an individual have those symptoms or those conditions, it is pretty severe, right? Didn't you say that in Orange County we average about 1 to 2 cases a year?
For those that are hospitalized with
Right.
really high cases.
Right.
Or yes, so in lower cases, so we have a response time for that depending on where the level is.
Right.
And so we do have a number of cases in Orange County each year that we reach out to.
Okay.
And our top 2 cities right, with highest zip codes are Santa Ana and Anaheim.
Okay.
And so those have older housing stock.
Okay.
We also have folks in those communities that we need to make sure those kids are getting lead tested.
But so the housing, but when you talk about housing, do you also mean their piping system within the home as well?
So it could be, although what's really interesting in a lot of our cases, and I've been doing this for 17 years now.
Okay.
Right?
She started when she was in junior high.
You're so... No, but seriously. So when we go out to the home, right, it's very rare that we will find water fixtures, and we do water testing. So it's rare that we'll find it actually in the plumbing. It might be in a plumbing fixture, but very rare.
Okay.
Sometimes in the crocks that people put water in,
Okay.
we've had hits with lead on that.
Okay.
But more often than not, honestly, in the older housing stock, it is lead-based paint,
Okay.
lead dust,
Okay.
lead and soil.
Okay. Now, I learned also that just because you find out that you might have lead in your paint, you can't just scrape it and do it yourself. You have to bring in a specialist, correct? Okay.
Correct. So
Talk
in
about
fact,
that, please.
right, when we talk about, oh, I want to remove all the lead from my home, well, actually, that's very costly.
Okay.
Right? Because we're talking about actually replacing components or replacing siding or windows. And not to say that we can't do those things to make it more energy efficient, more mirroring a healthy home. But the reality is we want to make a lead safe home.
Okay.
And so when people are living in these older 1940 homes, 1950 homes, we want to make a lead safe. So anytime you find chipping, cracking, peeling paint, those are called lead hazards. And what's interesting is a new law, Health and Safety Code, was passed.
Okay.
And so it states that a local or county enforcement agency has to respond and
That's us.
investigate. That is us. And investigate a lead hazard or a substandard housing complaint.
Okay. So you just brought up a whole can of worms and let me be. I'm going to ask you the question.
Ask me.
I am renting one of those old homes in one of these zip codes. Okay. I'm poor. I am somebody who is undocumented. What guarantee or suggestion or encouragement do you have for me in order for me to trust you enough to say, come help me? Okay. Or even file a complaint about the homeowner who rented to me that,
right.
You know, this is happening and he or she's not doing anything.
Right. So in a situation such as this, right, our job is to protect the public. Our job is not to report to Homeland Security or work with,
okay.
Folks who would deport somebody. That's not the goal, and that's not what we do.
Okay.
So in a situation where families might be undocumented, right, we want to take a wholehearted approach and one, investigate if there is a lead hazard, okay. because that could be an immediate, problem for the family or a child.
Okay.
Two, we want to get them plugged in with our public health nurse team, right? They are going to advocate for the family. They're going to work with either finding a clinician or a pediatrician if they don't have one already, through services that we have available, and make sure that they have a medical home.
Okay.
To get a holistic approach, not just because of the lead, but there could be other things going on. You mentioned anemia, you mentioned a couple other triggers that really we need to make sure the family is safe all around.
Okay. So let me ask you another question.
Sure.
Let's just go full blown out of this, okay? What if I'm renting from somebody who is a stingy homeowner who doesn't want to spend money in fixing up my home? Is there any funding available from the government to help that homeowner to fix the home for me? Because what I'm afraid as family in that situation might be raising the alarm, but then get threatened by this homeowner that, hey, if you don't like it, move.
Right.
Right?
So
let's be honest, that could happen. So,
yeah, and there's a couple things that family needs to know. So first, there is a law against retaliation.
Okay.
Okay, so that's currently in place. Second, you need to know that there is another law that was passed, and it does cap how much a property owner can raise the rent within a year period. And it's no more than 10%, although some jurisdictions like the city of Santa Ana has lowered that to 8%.
Okay.
So they need to know that there are laws in place to protect renters, and that's really important.
Okay.
The other is that if you have been threatened or an accusation brought against you or they're being wrongly evicted, there is there's not only Legal Aid Society, but Fair Housing with Orange County.
So let's say we don't want to go there, right? And hopefully everybody's good, but everybody's on a tight budget, including the homeowner. Is there a grant program that
There
help
is.
people? Okay.
There is.
Share that
So this is
information, please.
hot off the press.
Listen, this is hot off the
Okay.
press.
So we've been
camera
working-
onto Jennifer.
We've been working really hard the last several months with the state. So they took on a HUD grant, right? They were only allocating it to 2 counties in the
Housing
whole
grant.
state.
What's HUD stand for?
So this is U.S. Housing and Urban Development,
Perfect.
right? So they're a federal agency, but they have a lot of funding opportunities for grants. And so CDPH, which is California Department of Public Health, took on an amount of money
Okay.
for lead hazard reduction. You might ask, what does that even mean? It just
Okay.
means making a home lead safe.
Okay.
Right? And what that means is that now Orange County is viable to receive, and we have 1.3 million over the next 3 years that we can allocate to help low-income families, renters, and or owner-occupied. And it also allows them to be not only lead safe, but brought into healthy homes.
Now you said we are 1 out of 2
Counties in the whole state.
Why us? I just wanted to make
Because
sure that people are not alarmed that they picked
We
us
hustle,
because-
Dr. Chow.
Okay, very good. Thank you.
hustle.
Okay. We-
And we wanted that funding.
Okay.
We have an opportunity.
Okay.
We want to work with our constituents and not only just in the cities to make this opportunity available, but we also have a contractor that was awarded, which is Azure Community Development. So shout out to them and their staff, and they are working with Local 300
Great.
to make that happen.
Kudos to your team. Thank you so much for doing that. We got it because you worked hard to get the grant, not because we are the worst county in the state, and that's why we got the grant. Okay, very good. What is the number for people to call if they're interested?
So I believe there is a flyer for Azure Community Development, and if that is not made available, what we can do is you can call our health referral line and we can get you in touch with
And the number is?
them. So the number for health referral line, and I'm sorry I don't have it
I
off
have
the
it.
top of my head.
714-562-6220.
Yes.
Right? Or you can go on to our website, ochealthinfo.com/lead, and there's all the information in there. So thank you so much. That's a great team. Let's go to the very last short video that we have created to run on social media to continue to support our community as related to this issue of lead poisoning. So very short. Let's go. OC, and tonight we are talking about lead poisoning. We only have 10 minutes left, and I feel like I have a lot more to talk to you about, Jennifer. Maybe we need to bring Jennifer back for part 2 of this, right? But So you guys secure a grant through the state, folks. 2 jurisdiction out of 61 get that grant only. So thank you so much for that work. We gave you the phone number to call. We'll repeat it again at the end of the show. But more than that, we have public health nurse program. Talk about that one too.
Yeah, so our public health nurse team, honestly, this is a two-body part. So if they're our right hand, we're the left.
Okay.
And we work simultaneously. So they'll manage case management. They'll take in health referral calls, parents that are concerned. What are my next steps? What if I got this blood lead level? What does that even mean? How can I prevent something from happening? And so they'll reach out to us and we'll go out to these families and we'll investigate the home. So we test water, paint, dust, soil.
Okay.
And then we also are able to screen for non-housing items, things like spices, candies, toys, medicinal items, maybe Ayurvedics
And
or other
actually
things.
cosmetic stuff too. Right?
Cosmetics as well.
We didn't
So
talk
we're able
about
to
that.
do all that. And then we send it to the state for confirmation
Okay.
analysis, but we are able to screen. And so oftentimes we are successful in finding what the hazards are in the home, and we communicate that right then and there to the family so that they have peace of mind. This is what I need to do to make my child and my family safe.
And it sounded like our approach is very comprehensive, right? If there's any legal involvement, we will refer you to the nonprofit legal entity in Orange County that could serve you for low fee to no fee, right? And if it's a matter of repainting your house, we now have a grant that's available that we could tap into it.
Correct. And those that don't meet the financial requirement in our property owner, they're still held accountable for their property. And so we will work with that property owner to get a certified company in to abate the lead, do the work safely. If we need to relocate the family so that they're not impacted and that level doesn't go up, we will do that.
Yeah.
And so we've been successful in being able to complete that for families.
Is there a specific case that in your mind that you could share in beginning to end on how we intervene? Sorry, I didn't mean intervene. Any specific case that you could share?
Actually, I have one current one.
Okay.
Okay, so we
don't tell us the
No
city. Okay,
HIPAA
very
stuff,
good.
but no. So we had one with multiple siblings, other families living. So a lot of families living inside this dwelling. We were able to get others tested. Okay. We did find some higher levels. And
No. Stuff from the beginning. Sorry, I didn't mean to.
Oh, no.
How did we come to aware, or the family come to aware?
So the first one was the first child got tested, and met state case.
The first child. How old was the kid?
I believe there were 2.
2. Okay. So the pediatrician tested, right?
Correct.
Good. And then
that level from the lab goes to the state. The state notified the local health jurisdiction, which is Orange County.
Okay.
And our local lead grant. And so they worked with the nurse team. And so the nurse then contacts environmental health specialist. We go out together to these so that way we can communicate what we're finding, how we can best help the family is our approach in Orange County. And so we go ahead and we tested the home. We found quite a bit of lead-based paint and soil. And so good news is we were able, after a long while, to get an abatement firm to come in. And now we're working on the healthy homes aspect of it because there was a lot of mold and some other vermin activity. And so we want to make sure that family comes back to a safe home. And so hopefully we'll be able to clear that property within the next week or so. And so we're hoping to move that family back home for the holidays.
But wait, so the family moved out of that home?
Yeah, we had to relocate them
to
another location.
Did we pay for that, or the family paid for
We
that?
did talk about paying, but they're with other family right now.
Okay.
So that's what they worked out. And then, but we did have to put all their belongings in storage, and so the property owner was paying for that.
Oh, good. Okay.
Yeah.
So the only issue I have with, and it's a clarification, was it or is it the I assume this in this case a pediatrician because the kid is 2 years old, right? Is it the pediatrician responsibility to also inform us the minute the kid tested with lead in the blood or not? Because your story said we got notified from the state.
Right, right. So the pediatrician should be communicating to the family
That's right.
first, right? Because that's the relationship. However, they're required by state mandate to have all lab work that's conducted to go up to the state. And so then the state is now in charge of filtering out all those data and sending it to the appropriate jurisdiction where the child lives.
I just want to make sure people understand. Is it the pediatrician's responsibility to also not only send the lab up to the state, but also contact us, the local jurisdiction, and inform us?
Sometimes they do, but sometimes they don't.
The regulations that they should. Is that correct? So we need to make sure that the pediatrician has information on where to contact us, right?
Now, so a question for you then on the lab, because just from my awareness, it's kind of like whenever you have a positive, especially in lead, even if I don't report it, I believe labs are reporting it or there's
To the
some-
state.
Correct.
Yep, we know
and
that.
that's how it's caught.
We know that.
Correct.
But technically, pediatrician should also report
Yes,
it to us,
correct.
right?
Correct.
And I think
They
that's the
can reach
law.
out, and we do have some.
Okay.
We do have
Good,
some,
good,
but
good.
I can say that's not every case. And so it's really important to have that network.
Yeah.
Yeah.
So it's just a matter of us communicating with the pediatrician, because we have a very good relationship with the local chapter pediatrician, so we can make sure that we keep reminding folks that they need to do that to us.
Right. And if children receive services, they do. The public health nurse does reach back, and we communicate with the clinicians.
Right. I guess I want to make sure that the onus on it is not on the family, right? Because we want to make sure that our family know that we have a health system in Orange County that really, really support them, right? That we do everything just to protect the children, of course, and then the family for that matter. So thank you so much for what you
You're
guys
welcome.
do.
Thanks for having me.
That's just fantastic. This is what we do from a public health. So what I learned from this session is that if you own or rent an old home, you really need to get it tested for lead and see if you need any intervention, right? And now for the next 3 years, we have funding to support
Correct.
whatever you need to fix, but you also need to get the right people to do it, right? There's the state Environmental Health Protections Agency have a list of certified folks who are handling this type of lead poisoning. And so you can go onto the state website and look for that list,
Right.
or you can call us.
Call the health referral line.
Yep.
We'll point you.
Call the
We'll
health
walk you
referral
through.
line. The number is 714-567-6220, or simply go onto our website, ochealthinfo.com/forward-lead, right? That's number one. Number two, if you believe that your child might be exposed to lead, then talk to the pediatrician, get your kid tested, right? You need to be tested. If an adult in the family work in an environment that really expose them to lead, right? And then one of the things that I've learned is that, and I'm guilty of this, because lead is in the environment and you don't know where, in which environment, right? Make sure your house is freed of dust. Please make sure your house free. That's new to
Cleaning,
me, right?
just general cleaning.
You get lazy, you busy.
Wet cleaning.
Wet cleaning, right? Okay. Do not use hot water to cook food, right? Because it depends on where you live. Hot water could just stir up the lead and what have you. So use cold water. But the most important piece is if you have children under the age of 2, make sure you answer the screening, or make sure your kid get tested for lead, screened for lead at 12 months and 24 months. Simple, right? Things that, doesn't hurt, might take a little bit time for you to go to the lab, get tested, but it really, really keep your child really healthy, because by the time your child has symptoms, it's a lot of work, you want to be able to prevent it. What else? Anything else?
I would say that if, sometimes we have multiple kids in our family. So if you do have a lower level, it might be a good idea to get the other children tested too, just to see what you're dealing with and where,
The bottom line is there's help. Please
Testing.
reach out. Thank you so much, Jennifer,
Thank you for
talking
having
to
me.
us tonight. This is really important. I know we didn't get any question from you all, but please send us question to yourhealthmatters@ochca.com, yourhealthmatters@ochca.com. Continue asking us questions about lead too. You have any issue, maybe we need to bring Jennifer back for part 2.
Well,
but I
next
still
week
have
is Lead
questions.
Week.
Yeah,
Lead
I still have
Prevention
questions.
Week,
Lead
so
Prevention
yeah.
Week, let's plan on that. Next time on November 1st, please tune in. We will have Dr. Patricia Reba back with us, but it's going to be a very interesting show. It is going to be about prepping for healthy food in preparation for the holiday, right? You have Thanksgiving meals, you have Christmas meal, you have New Year's meal. I guarantee you it's going to be very interesting. It's not going to be at the studio, but it's going to be at an actual kitchen in our environmental health department. So we're going to be sharing with you some really yummy recipe, healthy, yummy recipe. But we're going to talk about food and health as well. So thank you for tuning in. Between now and then, send us an email, yourhealthmatters@ochca.com. Thank you so much. Have a good week. Bye-bye.